Okay, I'm ready.
Okay, before we proceed, the people who have been listening, please actively participate. Okay, we will need you to give a feedback after the station ends in the 8 minutes. So we'll put a 8 minute timer now. Okay, we can start.
Hello. My GMC number is 123456. Hello.
Hello.
My name is Dr. Umair Sultan, one of the junior doctors in this GP clinic. Could you please confirm your name and age for me?
Yes, doctor. I am Nikki Powell, and I'm 20 years old.
Okay. And what would you like to call?
You can call me Nikki.
Okay. Nice to meet you, Nikki. So, how can I help you?
Well, doctor, it's a bit personal. I'm not feeling good lately. I have
O-
I have joined this new job recently, and I don't feel good going there.
Okay. I can understand that it's really affecting you. But can you please tell me, like, what do you mean by you don't feel comfortable?
Yeah, doctor, the people there are like talking things about me. I'm like, just
Oh,
because I'm a lesbian, it doesn't mean that they can talk shit about me. Like they talk so nonsensical stuff right in front of my face.
I'm
So
really sorry. Okay, okay, continue.
yeah, it's very distressing for me.
I'm really sorry to hear about that, Nikki. This should not be happening in the first place. So you have mentioned to me that you go to your work and some people's trying to talk about bad things about you. Is that right?
Yes,
Okay. So may I ask, like, all the peoples in the office try to talk like this, or there are some few peoples?
yeah, there are few people. Like there are two, three people.
Okay. And apart from this, like, did they just talk against you, or did they try to harm you?
No, they just talk.
Okay. And what about the others? Did the others stop them, or they did not bother?
I don't know. Like everybody seems to feel like that nobody cares.
Okay. And did you try to talk to them?
No, I'm very scared.
Why do you scared about it?
Yeah, because I don't know if I talk to them, what if they don't understand and it will hurt my feelings.
Okay, I can understand. It must be difficult for you. I will try my best to help you, but let me assure you once again that what they are doing is not right. Okay.
Hmm.
So apart from this, do you have any other problem in your workplace?
That's it, doctor. Like because of this, I'm really not able to focus on my work. I feel so anxious.
Okay, okay, I can see. Okay, apart from this, did you try to talk to your manager?
No,
Okay. So you mentioned to me that you are lesbian and you like recently joined this work. So may I ask, like, is this the same thing happened in your previous work?
no, this is my first job.
Okay, okay, okay. So may I ask, like, whom do you live with?
Yeah, I live with my partner. Please don't tell my partner, doctor. She will get so
Okay,
distressed if she comes to know about this. It's just
okay,
confidential.
okay, okay. Relax, Nikki. We will not discuss with her. Just don't worry. Okay. Apart from this, do you have any close friends apart from your partner?
No, I don't have anybody else.
Any family? Any your parents? Anyone?
Yeah, I have my family. Yes.
So do you think that you can talk to them about this, that you're
No,
feeling this way?
no, I don't want to talk to them.
Okay, okay. Apart from this, like, may I ask you about your like general health? How is your like health these days?
Uh, my health, otherwise, I don't know. Like, I feel very panicky and I feel like my heart is racing sometimes.
Okay, I'm really sorry to hear about that. Is it the first time that you have feeling this? Yeah.
Recently, like from last 2, 3 weeks, I've been feeling like that.
Okay, okay. And apart from this, like, did you have any other symptoms? Like, do you have any low mood?
My mood is fine. I'm managing.
can you please score your mood for me? One the lowest and 10 the highest.
Around 6.
Okay. And what about your sleep?
Sleep is fine.
And do you like do you feel that your appetite is good?
Yeah, I do feel like that.
And do you feel difficulty in concentration?
No.
Okay, okay. Thank you for giving all this information. Apart from this, may I ask you some personal questions regarding your sexual life?
Yeah,
Okay. So are you mentioned to me you live with your partner. So do you prefer safe sex?
yeah, doctor, I do.
Okay. And apart from this, like do you have any other thing that you want to discuss?
Like what? I don't want anything. That's all.
Okay. Do you have any other medical condition?
No.
Are you on any medication right now?
No.
Okay. So are you allergic to something?
No.
Okay, thank you for giving me all this history. If it's okay, I would like to examine you. I
Mm-hmm.
will check your vitals. I will check your observation. I will also listen to your heart. Okay.
Okay. Right.
Is there anything?
No, nothing.
Okay, thank you for letting me examine you. There is all your vitals are normal.
2 minutes remaining.
Okay, all your vitals are normal. So from the chat we had, we discussed that you feel this like this, and you feel uh, bullying in your uh, work. So it seems like it's really affecting your life. So maybe it's due to this condition that you had difficulty in your concentration. So let me explain to you some things that you can do by yourself.
What can I do?
Okay, first of all, try to talk to your manager.
Okay.
I i can help you with that. I can like uh, say give you some notes that you can or talk to him about what you are feeling like this.
Mm-hmm.
Okay. And
Okay.
I would highly like appreciate you if you go and talk to the persons that they are bullying you.
Okay.
Okay. Try
Mm-hmm.
to talk to them that how you feel about it.
Mm-hmm.
Okay.
Okay.
And as I have mentioned that there is some equality law, we call it gender equality law 2010, which means that nobody is allowed in UK to bullet anyone regarding their gender orientations.
Oh, I see. Okay.
Okay.
Mm.
So you have equal right to be happy, and you have equal right to like live as much as you like. Okay.
Okay. And is there any support groups I can go to?
Yes, there is some support groups, LGBTQ sports groups, that I highly advise you
Mm-hmm.
to you can check. And if you have already joined any group,
No.
okay, so I will give you some group links that you go and make help there.
Okay.
Any other concerns?
So like, what can I do about like this? My heart is racing.
Okay, so for that you can try some times up.
And
Okay.
what do you think? Where is are your videos on? Okay, I can see. What do you think?
I guess I spent too much time in the history, or maybe I missed some important part in the history.
What you missed?
Like maybe other symptoms other than anxiety, any other thing, or maybe something related to bullying or hallucination, suicide, anything.
No, hallucination is not required. Suicide you can ask.
Yeah.
And bullying questions you did ask. And psychosocial history did you ask?
Yeah. I asked like whom do you live with? What do
What all is included in social history?
what do you do for a living? All
Mhm.
these, and any friends? How is
What
affecting your life?
what else
All
is
these.
there in social life? Eating, food, lifestyle.
Yeah. Yeah. Lifestyle, eating,
You didn't
drinking, smoking. I guess more important here, drinking and
you didn't ask,
smoking.
right?
Yeah. I didn't ask that.
Psychosocial history was not complete. Okay.
Yeah.
Then what else in the history? Then of course palpitations you didn't explore at all.
Yeah.
You missed
Yeah.
it. Okay. What do you think about the IPS? How was your IPS?
I guess I was little shaky. I don't know what happened, but I was not as much good when I was trying to explain to her.
Okay. All right. And your management?
I guess my management was not complete. Time's up.
Yeah. Okay. Fine. So let's take feedback from the people who have listened quickly. Anyone? Anybody wants to say something? Quickly unmute yourself.
I feel like the question about STDs was inappropriate. Lesbians, if anything, have less STDs than straight women, and I didn't see the relevance. I also felt like the management, it felt a bit like you're talking to a 10-year-old kid who told you he was being bullied in the playground. It wasn't like, I felt it lacked like more medical aspects. And also you didn't like, do an EKG, send her to maybe like a blood test, check for anemia and hypothyroidism, other things that might cause palpitation, just to roll out an organic source for the complaint.
Okay. What is the first thing you mentioned?
I said that the STD question felt very inappropriate. Just out of nowhere, what is your preferred
Oh,
sex?
yeah. Sexual history was inappropriate. I also felt
Yeah.
that. Okay. All right. Thank you. Anybody else? Anyone else? Come on, guys. Say something. No comments? Yes.
Actually, we can teach some relaxation techniques so that she can
Okay.
cope during the panic attack.
That's good. Anything else? Anyone wants to say something quickly? I think there are many things you can could point out in this performance. Anyone wants to say something? Come on, guys, speak something. All right, that's fine. So,
Yeah,
yeah. What do you want to say?
like some counseling sessions we can refer them, like cognitive behavioral therapy. Some if he need, we can refer him to a
Counselor.
yeah, counseling
Okay.
sessions and some meditations and some relaxation techniques to relieve her from anxiety feelings. Yeah.
Okay. All right. Okay. So, anybody else before I go proceed with the feedback?
Yeah, I
Yeah,
want to ask a question. Can we add beta blockers to in her treatment or management?
Beta blockers at this point, talking therapy is enough. Usually, beta blockers is not given at the first shot. So, first try with talking therapy. If it's not getting better, we can consider beta blockers for panic
Okay.
attacks.
Okay, thank you.
and also I think in the personal station, we don't need examine the patient because all of the things is a medical, doesn't need to examine the patient.
So, you're saying we don't need to examine because?
Yes, because the personal problem usually doesn't have any physical abnormal we can
The
find
thing
in
is that
the
she's
physical
having
exam.
palpitation, so we need to find if there is any organic cause. So, I think examination is necessary.
But if we discuss with the patient, maybe find any causes, with sometimes they drink alcohol a lot to compensate the situation. If find something in physical exam in the history taking, maybe doesn't need any examination because you can save time to for management and other things.
Yeah, but we, of course, you won't have to examine, you just have to verbalize. So it just take 20 seconds, but you should verbalize that chest examination for heart and lungs and vitals, very important, because there could be some other causes of palpitation. So we have to do an investigation also need to be mentioned in this.
Mm.
It's important. Anything else?
Yeah,
And we need to safety net about some suicidal thoughts, like for safety netting.
Yeah. Okay, that's good.
Yeah, can we give a sick note for the patient because he's bullying at work, and give sick note to get relaxed and get some off work.
Sick note can be offered, yeah, but at this point, that is not the most important thing to be managed. You won't get time to reach sick note. Right now, the purpose is to rule out the root cause, not to give a symptomatic treatment. If the root cause is bullying, that is needs to be addressed properly. That will take a lot of time, so you won't have time in the management to tell about sick note, anyways.
Okay,
Anything
thank you.
else?
We can thank the patient to bring this issue to us.
Yeah.
There is lots of courage behind it, so we can address it, and we can ask her to speak with the partner and friends. That's also fine.
All right. Okay, that's great. All right. So overall, I think the station, the way he was doing in the beginning was much better. I don't know, middle, somewhere he got slipped and he didn't explore. Like the bullying part, he did well. He did ask some good questions. Who is bullying? What are they saying? And how many people are there? Did you try to tell anyone? How is it affecting your mood and stuff? He did ask somewhere in between. When I mentioned about palpitations and stuff. He didn't really explore what is palpitation. I don't know why. Maybe he just assumed that it is a panic attack or anxiety, but that is not the right way to approach it. And then he started asking about sexual history. That is also not important in this station at this point. Okay, sexual history doesn't mean anything. You can ask how is the relationship with your partner, is they supportive, that's important, not sexual history. And he didn't ask about lifestyle also. If he would have asked, I would have told I'm drinking a lot of alcohol to cope up with all of this. So that was missing in the history. Then in the examination, I think he mentioned about chest examination, heart and lungs, that's good vitals. Investigations didn't mention. So we have to rule out other causes of palpitations, thyroid profile, ECG, blood profile, and all these things needs to be done. Then the management also, he didn't really explain what is happening properly. He just told like, it seems that you are suffering the bullying. That is such a wrong way to say. First you have to tell that what is happening to you is wrong. This is basically work harassment at workplace or bullying, in other words. Okay, so you have to explain first. Okay, don't just say that, oh, you whatever is happening to you is because of bullying. You have to explain what is bullying first properly to the patient, what is happening to his bullying. Okay, it is totally legal. He did the equality right, so you can mention that there is an equality law, so nobody can tell anything to anyone on the basis of their gender, sexual orientation, or anything else like that. Then she is basically, and tell her, so reassurance was not done. So like another doctor told, it seemed like he's talking to a child who's being bullied by his friend, a 10-year-old child. But even that is not the right way to put it out. But it didn't come out the way, he didn't reassure, didn't acknowledge properly. The management was all in the air. So you have to be very sympathetic and empathetic. I got this station in my exam. So you have to be very careful in this. Patient will be very distressed. So you can see that you can say that what is happening to you is totally wrong. You don't deserve this. Okay, I'm very glad that you have come to us and opened up to us, and I will make sure that you will feel better. And I want to tell you there is a lot of support available, and you don't have to put up with this anymore. Okay, are you with me so far? There are many things you can do. All right, would you like to know about that? Okay, so first thing is that sometimes the bully may not realize that what you're going through. Okay, so they might be doing this unintentionally. So maybe you can directly talk to them out. What do you think about that? No, doctor, this doctor, that's doctor. Okay, no worries. That's totally fine. Okay, there are other ways. Why don't you consider talking to your manager or supervisor? So in my exam, the simulator was asking, so who can I talk to? Who can I talk to? Who should I talk to? So you can say that you can talk to your supervisor or human resource, manager, or I can find it out for you. I talk to my seniors and find it out who exactly you can talk out. And you can also consider putting the formal complaint. And I would highly advise you to maintain a diary in which you write everything that is happening to you, so that in future, if you lodge a complaint, you have the proper evidence with you. What do you think about that? So that is the addressing of the bullying part. Second is the palpitations. As you are having palpitations, I asked you many questions to rule out the possibilities. So it seems that you're having the panic attacks or anxiety because of the bullying that you're experiencing. Okay, so there are a few things that can be done about it. One thing is that we will refer you to the counselor, one talking therapy that will help you. You can share your thoughts and feelings with them, and that in talking in private space, that will really unload your all this emotional that you are gathering, emotional damage. What do you think about that? Okay, that's great. Then we can also give you some, you should consider some relaxation therapies, yoga, breathing exercises. These small things can make world of difference for you. What do you think? So like this, you can explain about this. And of course, as you're taking a lot of alcohol, I'm very sorry to say, but I don't think this is the right way for you to cope with this condition. Okay, drinking alcohol, it can is in itself, it might give you temporary relief, but itself is increasing your anxiety. So why don't you consider cutting down on the alcohol? Okay, doctor, what can I do about it? So again, I'll refer you to the support groups and call anonymous support groups, and there is a lot of medical support available for you as well. What do you think about all of that? Okay, then in my exam, the simulator was asking actively what support groups are you referring me to? So Broken Rainbow and Stonewall are the LGBT support groups where I can refer you to. Okay, then you can offer her the crisis card, and in case her mood is low, and you can consider why don't you talk to your partner, because I think it'll be really helpful for you. So we can consider couple therapy if you want. So all that is the management. So management was off, so I'm talking more about the management. So you have to make sure that cover all these points, touch the bullying part, address the bullying part, how to handle it, address that, then address how to handle the panic attack, then how to cope up with alcohol intake, and LGBT aspect, LGBT counseling by referring her to the proper support groups. Okay, so this is the management aspect. And for the this thing for the history part, so in the beginning, so when the patient will be very hesitant, or will be when saying that, so you have to do some management there itself. What you're going through is totally wrong, this doctor did well, so you should not go through that. I think the initial bit was very good the way he did. And you have to, when I said that is this confidential, don't tell my partner, so I think there he didn't reply properly. He said something like don't worry, something like that he said, but he didn't really respond as it's a confidential space, it will stay between us, and all these things. Then palpitations, how we explore Ford para, we have to do, like, I don't know if you guys know, Ford para is basically a mnemonic to explore anything. So first is the first time we are having this, how did it start, onset, duration, progression, how is it progressing, anything makes it better or worse. So you have to do Ford para, then differentials, cardiac causes you to rule out any chest pain, any breathlessness. Then what happens, is there any particular time when you experience, you might say that when I'm about to go to work I experience that, how do you cope up with that? You ask all these things and rule out the hyperthyroidism, pheochromocytomania, sweating, any flushing of the face, any weight loss, you should ask. Any questions? Any question, anyone? So is
No,
it,
doctor.
yeah. Dr. Umair, are you happy with the feedback?
Yes, I am very happy, and thank you all for all the lovely feedback. I was really confused in LGBT questions, and sometimes I'm not able to manage the station on time. That's why I guess.
All right, don't worry. You did the initial part good. Just work on. Don't miss out crucial things, and don't ask irrelevant questions like sexually.
Yeah.
Okay. All right. All the best for exam.
Yeah, thank you. Thank you so much, doctor. Thank you.
Next person.
Should we like specify breathing to a paper bag, stuff like that, or should we just
Yeah, we
say?
can mention. So we can say that there are some ways to cope up with it. Like if you experience the paper, you can breathe into the bag, and this will help you to come out of your panic attack.
Like,
so that is
who know to teach her? The physiotherapist know breathing techniques, or is it this the responsibility of the GP?
what breathing techniques? So
Breathing.
that, yeah, that you can just